Hi there, this is Brett Rogers, massage therapist and YouTube educator, and today I'm going to show you how you can heal your herniated bulging disc problem. And I've watched some of the physical therapist videos on this, and I'm sure that you'll get a lot more out of this video than those, so stay tuned. Now the first thing that you need to learn is why. Why do I have a herniated disc? Let's take a look at this chair that I'm sitting in here. This is a natural wooden chair, and it promotes good posture if I make an effort to sit up straight. That's important, making an effort. Yes, it is also important to have chairs that actually promote good posture. But you've got to get it into your head to start making an effort. Okay, so when I'm sitting up straight like this, my vertebrae are stacked on top of each other pretty straight. But as soon as I start slumping like this, all slumped over, then the vertebrae are going to go like this on an angle, and the disc that's in between is going to start to bulge that way. Simple physics, isn't it? When the spinal cord here is getting pushed on by the disc, then you get pain. So what's the logical way to work your way out of this problem? We want to start to straighten up so that our vertebrae are stacked better, but because we've created a problem, we also need to push directly on the vertebrae, specifically on the area right here where the problem is. That way it'll straighten it out. So today I'm going to show you how to use all of these tools to work on your back and also your hands. This is a Theracane, and you can buy that just about anywhere online. These are Lana rollers, a 6-inch Lana roller and a 5-inch Lana roller. This is a regular wooden roller that you will only see on my site, brettsnaturalhealth.com. And this is a wooden or a leather softball that you can buy at any sporting goods shop. Okay, so the softball is for working on your glutes because it's very likely that your butt muscles are tight and they're also contributing to your back pain. Okay, so it all kind of coincides and they all connect, and so they're going to affect each other. Okay, so the first thing that I think that I'd like to show you is this 6-inch wooden roller. And sure, you can buy a foam roller at your hardware store or at Walmart, but the wood roller is going to last a lot longer. It's going to have better pressure. It's totally natural, and you really need to start thinking in terms of what's natural and what's not here. So you don't want to put any pressure on your back to start. You just get on your elbows and on your feet and gradually let it down and applying pressure and see how it feels to you. That's really important. How does it feel? Sometimes a doctor will tell you, don't do this or don't do that. And so then you don't even dabble at all. And what you've missed out on is the possibility of something really working out great for you. I'm not a doctor. I don't recommend. I don't give advice. I just show you the things that I've learned that really work and aren't just a bunch of garbage that's really, really expensive and invasive. Okay, so if you start pushing on those vertebrae the opposite way that you've been pushing on them while you're sitting for God knows how long every day, then you never know. They might just start to go back into position. But if you just do what the physical therapists are saying, which is this. Okay, the physical therapists are saying to do this exercise here, where you are up on your elbows kind of thing. And that's fine. But if you're not putting direct pressure on this problem area, then in my opinion, it's going to be a lot harder for those vertebrae to go back into position. Does that make sense for all of you that understand the basics of physics and how things work when you put 2 and 2 together? If you push directly on the fulcrum point, then the stick is going to, the stick that's like this, if you push directly right there, if I had a third hand, I'd show you. If you push directly right there, the stick is going to bend back straight better, right? Okay, so let's work our back with this other wooden roller here. And I really like this one more for middle and upper back, but you can also try this on your lower back. Once again, get on your elbows and feet first, and then release the weight of your body gradually down onto the roller. Now, if you want to put more pressure directly on the vertebrae versus on the soft muscle tissue, then what you do is you unscrew this like this, and you turn that in so that those will go closer together. Tighten it down, and look how close I got that. If you want, you can put them all the way together so that you're pushing directly on the spinal processes. And processes are the bony prominences that are sticking out on the outside that you can feel with your fingertips. Let's try that. This will be more aggressive on your vertebrae. Oh yeah. It's good, I'm telling you. Oh, yeah, I'm telling you, that is good. Right on them. Fantastic invention, if I don't say so myself. Okay, so the softball. A lot of you have seen this. And if you put it right under your butt like that, and you start to release those butt muscles, it's going to take the tension off your upper iliac crest, and you're going to feel better. Your lower back is going to feel better. Because you see, the butt muscles are connected to your obliques and some of your lower back muscles. And those are also part of the problem here. It's almost certain that because you've got tight muscles all throughout that area, that it's also part of the problem. Okay, so release your butt muscles and do this regularly. The more you sit, the more you need to do this exercise and the other ones too. Incidentally, you can take this wood roller and work on your IT band. That's going to be really important as well. Your iliotibial band is on the side of your leg. And if you roll on it with the wood roller like this, it's probably going to be really painful. That means that it's tight and sore and it needs to be worked out by doing this. Okay, so do this regularly. Another reason why this IT band might be tight and sore is because people sleep on their sides with their knees together and stretch that band constantly for 8 hours a night. Okay, so let's use the Theracane now. I've only got a couple minutes left on this clip, so I'm going to have to get on it. take some oil in a bowl and put it on your lower back. Take the Theracane and hold it here with one hand and here with the other hand. Something like that. A little slippery. Slide up your back. This is working the muscles around the problem area. It's conditioning muscles and helping them to heal. This is very important for somebody with back pain. Be sure and watch all of my videos on in these regards so that you'll start to get it in your head exactly what you need to do to get rid of your back pain and all kinds of pains that you may be experiencing. Okay? So I want to thank you for joining me. Please go to Brett's Natural Health, BRETTS, naturalhealth.com. Check out all my products. I hope you're doing well, and I hope you get past your sciatica or your slip disc or your bulging disc pain. Thanks so much. Bye-bye. Okay, so I also wanted to show you how to massage your low back directly with your knuckles like this. You got to have a little bit of oil on there. You can do one at a time like this too. Okay, so this is massaging the soft tissue around the problem area, but it's not pushing directly on the vertebrae. When you use one of these rollers, you will be doing that. Now, one other thing, the most aggressive one is this, a solid wood roller. Okay, so a solid wood roller is definitely the most aggressive of all these tools. Once again, lift up on your elbows and gradually release the weight of your body onto the roller, and you'll be able to feel the spinous processes and which ones are sticking out the most. That's where you want to focus. Gradually pushing them back into place and trying to get them even. And nobody can feel your back muscles and bones like you can. That's why doing self-massage and doing yoga regularly is so important. Nobody can tell you what to eat. You have to know by the way you feel and what you're craving. And in my opinion, nobody can work on your body in most ways like you can. So be sure and watch my videos and learn how to take care of your own body. So thanks for joining me, everybody. I know I said that before, but I want to wish you well. Bye-bye.